Hello, I'm Chris Grant, and this is a special presentation of the Permanente Medicine Podcast. Over the last few years, we've witnessed significant shifts in healthcare delivery, from the development of new virtual tools to reimagining the way we share resources. As the medical landscape continues to evolve, there is immense potential for improved patient care and outcomes. In the following interview with Dr. Richard Isaacs, we discussed how the COVID-19 pandemic accelerated innovation, the light it shed on some of the most pressing challenges in medicine, and how we can leverage our learnings to build a better future. Dr. Isaacs serves as CEO and Executive Director of the Permanente Medical Group, President and CEO of the Mid-Atlantic Permanente Medical Group, and co-CEO of the Permanente Federation. This interview originally aired on Modern Healthcare's Virtual Health Virtual Briefing. We live in interesting times, and all of us have encountered some unexpected disruptions in the last few years. Would you describe some of the greatest challenges you think we faced as an organization, both the expected and the unexpected?
Thank you, Chris. The healthcare industry continues to work through some challenges. And the pandemic brought about significant volatility, uncertainty, complexity, and really ambiguity during this, once-in-a-lifetime pandemic. And as we enter the post-pandemic world, we continue to see the direct and the indirect impacts of COVID-19 on our organization and on the healthcare sector in general. Kaiser Permanente, like all healthcare organizations across the nation, has faced challenges with three vital resources: staff, space, and stuff. We had this initially in March of 2020, and you and I worked really closely together to ensure that Kaiser Permanente had the appropriate staffing, the appropriate space, and the appropriate stuff. And we continue to deal with those three things. So staff, we're dealing with the highest level of healthcare inflation and economic inflation in decades, and we are experiencing the challenges of the Great Resignation. And during this last surge, this past winter, many of our people were sick with COVID and unable to work for extended periods of time. In fact, staffing has been an ongoing issue, and we've needed to depend increasingly on contracted staff, which increases costs significantly. So we've been continuing to work diligently to hire more nurses, more physicians and staff, so that we continue to develop the appropriate staffing levels with our internal supply. Space, since 2020, many parts of the country have experienced limited hospital beds due to rapid shift in care from because of COVID-19. There's been just surge demand for hospital capacity. We've seen it in our emergency departments, in our hospitals, and in particular in our ICUs. So in order to keep patients safe, we had to rapidly shift to provide care in alternative venues, in medical offices, in tents that were expanded, ER areas, and care in the home. Regarding the supply stuff, the pandemic disrupted supply chain throughput, creating a situation where states and health systems were competing against each other to have the appropriate PPE and other medical supplies needed to treat patients. Because of all these challenges, as an organization, we had to move very quickly to leverage technologies, including virtual care via telephone, video, and remote monitoring technologies that would enable us to provide healthcare when several of our peer organizations nearly came to a standstill. Fortunately, we had the talent, the culture of innovation and technology in place that allowed us to continue to serve our patients.
Yeah, Dr. Isaacs, just listening to you brings back such vivid memories. We literally worked 7 days a week around the clock on which and I love the terminology, staff, space, and stuff, because we simplified it, but the complexity of healthcare and bringing all of those resources to bear in order to prepare for tripling, quadrupling capacity needs and protecting our patients while protecting all of our physicians and clinicians and workforce was just so critical. And Kaiser Permanente is a unique model. And I'm curious to kind of understand your perspective on what is it about our model that enables us, and I'll use your words, to cultivate a culture of innovation and to respond to the pandemic so ably and really so quickly.
Well, as you know, Kaiser Permanente is an integrated model. And I think it is the model for how other health systems should deliver care, where you have collaboration with a health plan, a hospital system, and a healthcare delivery group led by physicians on the medical group side, which enables us to really think about how do we channel the resources to provide simply the best in patient care. And I think that the pandemic demonstrated our attributes in spades, because in early 2020, we had a very strong membership, and we had a prepaid model, which allowed us to make the appropriate investments to adapt to deal with the challenges in the community and also among our membership with COVID-19. So in a prepaid model, we were able to leverage technology in much better ways than other healthcare systems. The systems around me here in Northern California and in the Mid-Atlantic are heavily dependent on a fee-for-service model of care. So if you're not able to provide elective procedures, you lose revenue and you don't have the ability to invest. So I think that we did an incredible job leveraging the resources. We had a video care first strategy where very early on, all of our physicians were able to provide care to our patients from remote sites, preserving the hospital and the medical offices for those who absolutely needed it. And we were able to provide care. Like close to 90% of all visits were being handled with a video care first strategy, which really catapulted us to the next era of healthcare, which was phenomenal.
Yeah, it is incredible when you think about it. And to your point, a lot of our ability to respond to the pandemic didn't start, in March of 2020. The fact that we had migrated to electronic and video capabilities in an expansive way years ahead of time allowed us to prepare for this pandemic or whatever the nation may face long in advance. So we've talked a lot about innovation, and I'm interested to understand your perspective on what role did physician leadership play in establishing a vision for innovation at the Permanente Medical Groups and across Kaiser Permanente, and perhaps even more difficult, how do you sustain a culture of innovation during such complex times?
Well, thank you, Chris. For me in leadership, what's particularly satisfying is inspiring people and helping them achieve the potential that they didn't otherwise think was possible. I believe the physician leader's job is to encourage creative thinking and amplify the innovative spirit. And it's okay to make an error. That's how you learn. That's how you innovate. So the leader's job is to make it safe to make mistakes, because you learn from them and then make the system better. I also introduced the concept of servant leadership, where you take the traditional hierarchy pyramid, where the CEO or the chief of the department is at the top of the pyramid, where people are serving that leader. You turn it upside down. And now you have the CEO, the chairs of the department that are supporting the people closest to the work. And what you see is you unleash innovation. The people closest to the work should be empowered to generate new ideas and then supported by the leadership structure to help execute and implement those. And that's how you create a sustainable culture, by just empowering those people closest to the work, creating an environment of psychological safety where it is okay to come up with a new thought, to challenge the status quo, to take on some risk. Because if you take on risk and it doesn't work out, it's okay, because we learned that that's not the direction we should go. Here's a better way to do it. So just creating that flywheel of empowerment, experimenting, learn quickly, fail quickly, and then go into a new direction is what drives a lot of innovation in healthcare.
Yeah, that is one of the key secret sauces of Kaiser Permanente, right? Everything that we do, whether it's the design of a hospital, an OR suite, or a virtual care platform, is led through the eyes of the physician and the clinical team that's closest to the forefront, where the requirements definition, the workflow definition, the systems that ultimately support are designed, developed by physicians, and then we wrap it around engineers and programmers to make it a reality. But those requirements and the essence of how things look and feel and what's needed most are through the eyes of our doctors. I want to get a little bit specific here. What are some of the innovations we leveraged during the pandemic that allowed us to provide more accessible and affordable care? And you talked about moving to 90% virtual and not missing a beat with allowing patients to access their clinicians. I'm interested to understand where you saw some of the most innovative approaches during the pandemic.
Well, I think it's the technology integration that really escalated during the pandemic. Started with video. We weren't unable to provide, we didn't have the capacity with the space, so we were able to meet patients where they were using a video integration. And that quickly expanded to Get Care Now, which we now use across the entire nation for Kaiser Permanente, where you leverage technology and create a virtual contact center where there's automation and artificial intelligence, where based on the patient's input into our system through an electronic visit, the patient is able to navigate through protocols and ultimately is delivered to a component of the system that will deliver the appropriate care that they need. If it's something simple like a prescription refill, we navigate them through to our pharmacy leadership, which then is able to triage and provide the appropriate care. But more importantly, we're using advanced practice providers based on feedback that patients are giving in an electronic platform, the digital front door that allows us to navigate the internal system, which is heavily integrated, primary and subspecialty care working very closely together, which allows us to deliver a chat with a physician, a video visit with a physician, or even a conversation with a subspecialist and their primary care physician in real time, leveraging technology and leveraging video. And this was a vision that we had way before the pandemic, but the pandemic was the catalyst that allowed us to really expand that and move forward. And we're seeing a glimpse of what healthcare delivery is going to look like in the future, using a smartphone with our app, allowing patients to get what they need at the appropriate time and place.
I love it. And it's choice, right? It's choice for patients, whether they want to access a chat, whether they want to access a video visit, a phone call, or a face-to-face, enabling all of those to happen really on demand. And let's get to an even more complex care setting. So we talked a lot about video visits or chat with a specialist. What do you see for the future of advanced care at home, and how might it reshape healthcare and the patient experience?
So the technology integration has been phenomenal. I was talking about the patient convenient aspect. If the patient is interacting with our health system, they're able to get information that they need through this electronic platform. But we've been using technology to help expand care delivery in so many different ways. For example, telestroke. We have a hub of neurologists that provide immediate consultation to any patient in any one of our emergency rooms across the country that are having symptoms of a transient ischemic attack or stroke. And we're able to immediately see their radiographic studies, do an examination virtually and help the emergency department navigate through the complexities of thrombolytic therapy. And we're providing door to needle times that are leading the nation right now. And the outcomes are just incredible. We're using the technology to move expertise and not our personnel. We are doing this in Northern California, where every one of our critical care beds is monitored through remote hubs, where we have a telecritical care physician that's providing oversight and management of every one of our critical care patients across the country 24/7. So using the technology to expand care delivery has been really phenomenal for us. And another example of how our prepaid model and integration leverages that expertise to help provide the best care.
Yeah, it really is extraordinary when you think about it. And I can only imagine that we've got viewers on this Modern Healthcare Fireside Chat that are listening and saying, gosh, the ability to access a neurologist in a minute's notice, in the high desert or in Bakersfield, and be able to get clinical guidance so that a patient can be saved is just phenomenal. And to do it all remotely with precision is extraordinary. This last 3 years, when I think about it, the environmental factors that we faced, whether it's the pandemic or a changed economy or supply shortages, has just been extraordinary. And there's been so many external factors that have affected healthcare. What do you see as some of the key external factors that, and you talked about this earlier, that really accelerated or drove innovation?
Well, I think that in the early phases of the pandemic, just the mere fact that people were sheltering in place and were fearful to come in and to come into hospitals because of just the uncertainty of how COVID-19 is spread. We had a high percentage of patients with cold, cough, and flu, and we were able to isolate those folks to home care, providing an immediate consultation with a physician and triaging them to the appropriate venue within our healthcare delivery system to ensure that they're getting the best care. And it keeps the community safe as well. There are many things that we did to help transform safety in COVID-19. For example, in every one of our geographies, we partnered with the local, state, and federal health and human services departments to bring innovation to mass vaccination. And I'm really proud that in all of our areas, I think we curtailed infectivity because of the marked efficiencies that we provided to maximally vaccinate a community. For example, here in San Francisco, we were a key leader in the Moscone Center, which was vaccinating thousands of people every hour through our efficient operations. So I think that the pandemic created opportunity. So this organization has always converted challenges into opportunities. And I strongly believe that this pandemic was an impetus for much innovation across healthcare in every system across the nation. And it posed challenges for us as well, right?
Yeah, it's so true. And I often talk about the silver linings. And it's hard, when we all experienced, and you and I, walked through emergency departments and spent time in intensive care units and saw, some of the greatest desperation, from a humanity standpoint, amidst COVID. But we also saw the silver lining, and the silver lining, as a backdrop to that suffering, was the acceleration of technology. It was communities pulling together. It was, county public health departments and state public health departments working more collaboratively than they ever had before. And you can imagine the long-term benefits of some of that advanced technology, as well as that cooperative, collaborative spirit that came from this period that we just lived through. I visited Moscone Center, and I visited one of the high volume COVID sites in Los Angeles and in San Diego, and it was just extraordinary to see the precision and the volume, and almost the euphoria as individuals were getting COVID vaccinations and feeling a sense of relief that this was the beginning of lives getting back to normal.
Yeah. And I'm incredibly proud of the way that we responded. And there's so many areas that I think where we developed a new model of care. So we rapidly shifted to video visits. And in 2020, we conducted nearly 4 million video visits compared to 100,000 in 2019 before. And now every one of the chairs of our departments is focusing on how do we leverage those video visits to provide better care, more effective care, and eliminate redundancy. It drives experience for the patient and the member, but it also drives the most effective way to deliver care. Early on, this team developed playbooks that we shared broadly across the country with the isolation and mitigation strategies for COVID. And my team shared these broadly with elected officials. We had a meeting with every governor and their offices early on. This is a protocol which we believe it will help your states, which was great. And then the Division of Research within Kaiser Permanente conducted extensive projects, which led to over 150 peer-reviewed articles that were published regarding COVID-19 virus epidemiology, diagnosis, treatment, and prevention, and other clinical outcomes. So I'm incredibly proud of Kaiser Permanente, but as I mentioned, these are opportunities that come once in a lifetime. The challenges exist. You respond by empowering the leaders closest to the work, and simply the best outcomes are what are achieved. So
it's great. It's great, Rich, and you're right. I remember district hospitals, local nonprofits benefiting from playbooks and guidelines in order to accelerate their ability to care for an increasing needy population. What can healthcare organizations do to address the lack of access to digital technologies, right? You talked a lot about different electronic mediums to access care, but not everybody has the ability to access digital technologies. What is the kind of responsibility of an organization like Kaiser Permanente and many other healthcare organizations to address that access challenge?
So this is a great question. It's one of the things that I've been thinking a lot about over these last 2 years, because health equity is a priority for us. And how do we ensure, as we transition to more technology-enabled care, how do we ensure that people have access to technology? And, I was recently in a conversation nationally where it's clear that the cell phone penetration is pretty high, even in some underprivileged areas. So creating the access that leverages simple cell phone technology, as I mentioned, will allow access to care. It's going to require having a science and understanding what the true demand is and how do we meet that demand, leveraging both technology and also the healthcare delivery system to be able to deliver the best care. And I have many of my own patients travel via bus. They may have to take a couple of buses to get to my office, whereby if we could just do a simple technology innovation, we can avoid all of that travel and provide just as good a care. So it's really about eliminating redundancy in the healthcare system. And I think we have this tremendous opportunity to take technology to high levels to find the appropriate utilization of technology, which then creates the capacity for where we need it with the most expensive resources within the system, creating the appropriate capacity.
I love it. So it's it's meeting people where they are. Really, what you're saying is cell phones, like my iPhone is broadly used, or an Android model, and making sure that applications, that the ability to have a video visit or a chat doesn't require a desktop computer or a laptop computer, but is designed in a way that it can be in the hands of as broad a subset of the population as humanly possible. I also know we do a lot of work with local cities and local school districts in order to support the broadening of access to digital, the expansion of free Wi-Fi access, or low-cost Wi-Fi access, so that every community has the ability to connect and to access care. I want us to take out our crystal ball for a second here and talk a little bit about the new technologies that are on the horizon, and what you see Kaiser Permanente and the Permanente Medical Groups developing today.
So I think that as we think about the future, we've already pre-pandemic had been using recovery at home for surgical patients, for example, and we do surgical home recovery with 20 different specialties, surgical subspecialties, where when it's appropriate, we allow patients to recover at home. For example, 92% of all of our orthopedic total joint replacement surgeries have patients that are recovering at home, and this is all pre-pandemic. So as we move into the future, how do we provide advanced medical care at home? And I'm particularly excited about our partnership with the Mayo Clinic and Medically Home, as we are establishing protocols for the logistics and the monitoring of hospital level care that we can provide in patients' homes. And since the beginning of the pandemic, we've treated thousands of patients across our program that otherwise would have required a hospital bed, leveraging new technologies, remote home monitoring, and logistics and care in the home. And what we found is the outcomes are actually better when we appropriately select patients to get this type of care. So the crystal ball is, I think when you think about what is the hospital of the future going to look like, if there's a fair amount of surgical home recovery that can take place, that's fantastic. And as we expand acute advanced care at home, we're going to see more capacity of our existing hospitals because of the expansion. So maybe we'll need less hospitals in the future. Maybe the hospitals will look very different. I could envision a hospital looking like an ambulatory surgery center with operating rooms and a critical care unit, perhaps with step down, with the majority of medical surgical patients recovering in an alternative venue.
I love it. And, the fact that we operate a medical school keeps us at the forefront of thinking about the future. We've got, major residency programs that bring in the future clinician and physician to really experience and themselves help influence and design what the next generation care setting will hold. And I know, Rich, I think between the two of us, we're doing our part in solving the physician shortage. We've got three kids that are in residency or in medical school. So as we look to the future and we think about the future of healthcare, I think designing it in a way that really does increase accessibility, increase equitable access for all, and make it easy to access and easy to use is the key to the future success. So I love your vision. I love your hope and your confidence in what's going to come. Any last thoughts that you wanted to add to our fireside chat?
Well, it's always a pleasure to talk with you, Chris. And I think that we're in a moment right now in the history of medicine. We have an opportunity. When you think back from the great threats to health, the bubonic plague resulted in the Renaissance. The Spanish flu resulted in major transformation and discovery in healthcare. And I think as we emerge from this 2.5+ year pandemic, we are seeing just an amplification of technology integration and new ways to provide the best care. So I think we're on the cusp of another renaissance of healthcare delivery. I've been talking about this for the last few years. The industries around us have embraced technology, using smartphone for Lyft, Uber, delivery of food to your home, these types of things. And the consumers in this country are getting very comfortable using smartphone technology to get what they need. And it's now time for healthcare to step up and provide the same value that smartphones provide for other industries. So I think we're really in an exciting moment right now. We're coming off of a volatile, uncertain, complex, and ambiguous disease, and we've combated that with vision and understanding, and developing certainty and agility. Those are the antidote to VUCA. They also are VUCA: vision, understanding, certainty, and agility moving forward. And it's really an exciting time to be in healthcare. And I'm looking forward to watching your son and my 2 daughters as they move healthcare forward. So it's just been great.
I do as well, and I'll add to your list of characteristics, and it's strategy. Right? It's a clear sense of where we're going, and it's applying resources in a unique way to make it possible. So, Dr. Isaacs, I always have a great time chatting with you. I know that our modern healthcare listeners are really going to enjoy this conversation and the insight and wisdom that you provide. So thank you for being here. And thanks to all of our viewers and listeners.
Thank you, Chris.
Thanks for listening to this special presentation of the Permanente Medicine Podcast. Many thanks to Modern Healthcare and Dr. Isaacs. And be sure to catch up on the latest episodes of the Permanente Medicine Podcast, available on the Permanente Medicine website and streaming on your favorite podcast platforms. Subscribe to our YouTube channel to get notifications on when new content is available. The opinions expressed on this podcast are those of the speakers and are not necessarily the views of Kaiser Permanente, the Permanente Medical Groups, or the Permanente Federation.